So good afternoon, everyone. Thanks for joining us for Member Cafe. Going to wait just a few minutes to get everyone in the session before we begin. All right, so welcome everyone to December Member Cafe. We are so glad that you have joined us. My name is Ann Gluff, and I am part of the member engagement team here at Partners Health Management. So I want to just take a minute and introduce everybody that's here on our panel. So I'm just going to go in the order of my Hollywood squares here. So Beth Brooks is here with us. She is also part of the member engagement team, and she is our incredible backup to make sure our webinar is running so nice and smooth. And then to my right, I have Allison Crotty. Allison is Senior Director over Member Services here at Member Engagement. So thanks for joining us today, Allison. We have Beth Brown from Provider Network, excuse me. And then also Jaleesa Cole, who is new to the network provider team. So welcome, Jaleesa. Right in the center of my screen, I see Tammy Gilmore. She is our IDD Senior Clinical Director. And then last but certainly not least is Melissa Hatton. Melissa is part of our member engagement team, and she is going to be dropping some great information into the chat for you so you can grab it and quickly copy and paste contact information. So I wanted to let you know that today's session is offered in closed caption. You should see that link on your screen. If you don't need that closed caption, you simply just hover over it, click on the X, and that's going to disappear for you. And then just a few housekeeping items. I wanted to let you know that our session today is being recorded. So be cognizant of that and careful about sharing any personal information if you're talking and asking questions. Wanted to let you know that partner staff is available to you either after this call, or we can set up some one-on-one time if you give us a call at member engagement. And I'm going to share that phone number with you in just a bit. One question that always gets asked, are the PowerPoint slides going to be available? And the answer is yes, they will be posted on our website along with the recording of our session. Usually takes about a week for that to get posted. We are going to do a presentation for you. So during that presentation, as you think of questions, feel free to drop them into the Q&A. The chat is actually disabled so that we can enter information for you. But any questions that you have, just drop them in the Q&A and we will stop and answer your questions. So let's go ahead and get started. Beth, you want to pop that slide deck up there for us? All right, so welcome again to Partners Member Cafe. Why don't you go ahead and slip to the next slide there. Just want to share with you just a little bit of information about Partners in case you're not familiar. So our official name is Partners Health Management, but typically in the community, we go by Partners. We are super proud to share with you that we are a member care organization. We're a health plan, an insurance plan. We manage Medicaid and other state funds for services in North Carolina. So think of Partners as an insurance company, part government agency, since we work with state funds Medicaid. Partners doesn't provide treatment directly, but we do have a network of providers that are experienced in providing services for people with intellectual and developmental disabilities, mental health, TBI, and substance use disorders. So our goal at Partners is always to improve lives and strengthen communities by focusing on positive outcomes for our members. Next slide, please. So this shows you the counties that we cover. We cover 14 counties in North Carolina, and there is an agency just like us, a local management entity, managed care organization that covers all of the different counties in North Carolina. So next slide. So I am going to guess that you all have heard about the tailored plan. So the tailored plan is coming soon. Partners Tailored Plan will manage behavioral health, physical health, pharmacy, and care management services for individuals who may have IDD, TBI, significant mental health needs, severe substance use disorders. So all 6 of those current LME-MCOs, I mentioned there's one for every county across the state, will be managing the tailored plans in North Carolina. The tailored plans are going to serve both uninsured and underinsured recipients who may be eligible for state funds for health services and supports. And then I also want to let you know that some members with certain types of insurance and waivers will remain in North Carolina Medicaid Direct. North Carolina Medicaid Direct, that's how our system is operating right now. Where the LME-MCOs are managing Medicaid and state funds for those with behavioral health. And the physical health component of that is managed by North Carolina Medicaid. And then, of course, tailored plan will begin on April 1. Those who stay in Medicaid Direct, it will stay that way for them, how it currently is now. So what I want to do now is pass it over to our guest speaker, Tammy Gilmore. She is our IDD Clinical Senior Director, and she's going to share with you about tailored care management.
Good afternoon. So I am going to talk just a little bit about what tailored care management is. Anne mentioned that the tailored plan is bringing together behavioral health services with physical health services, and tailored care management is about helping coordinate all of that. It's whole person care management to really look at the whole person and have a care manager that's partnering with the member and the member's family or caregivers to ensure that the member receives appropriate care. And I'm certainly not going to read this graphic to you, but you can see that would involve coordinating not just with the individual and the family, but also pharmacy, physical health, behavioral health services, and what are called unmet health-related resource needs or social supports, things like transportation or housing, food insecurity. So the care manager would be there to support the member and the member's family in accessing and coordinating all of those types of care and services. Next slide, please. So the tailored plan does not actually start until April 1st. It was scheduled to begin December 1st, and then there was a delay, and the tailored plan is now scheduled to be implemented April 1st. But what did start on December 1st is what they call a soft launch of tailored care management. So individuals are eligible to begin receiving tailored care management during this period from December through March. Members who are in the tailored plan, but also some of those individuals are in Medicaid Direct. And what that means is that if you're in Medicaid Direct, your physical health services will continue to be managed the way they are now, but your behavioral health services would be managed through the tailored plans, and you would be eligible to get tailored care management. So that tailored care manager would work with you to coordinate all of those services I just mentioned, including physical health care, even though the tailored plan wouldn't be paying for it. Essentially what this means is that more people than ever will have access to care management. Care management has always been a very underfunded, not well-funded support that only some people were able to get. Individuals in the Transitions to Community Living program and in the Innovations waiver or in the TBI waiver were able to get care management. But other than that, care management was really somewhat limited to those with the greatest need or short-term at what's called episodic care management. So this really brings an opportunity for people, for a lot of people, many, thousands of people, to get care management that were not otherwise eligible prior to December 1st. Member choice is a critical component of tailored care management. Members can choose which entity or agency delivers their tailored care management, as well as who their care manager is or when they want to change their care management provider or care manager. We have a list of the care management agencies that have been certified to provide tailored care management, and so those that list becomes the menu, if you will, of your options for tailored care management. The care managers will complete a care management assessment. It's called Care Management Comprehensive Assessment. They will work with the member and the member's family as applicable to develop a care plan or an individual support plan, and then maintain regular member contact to assist the individual in accessing needed services or supports, resolving any problems, and ensuring that the person's needs are met. Next slide, please. Members choose or are assigned the agency that will do their care management. So let me talk a little bit about what the types of agencies are. Partners is the health plan, and Partners does provide tailored care management. So some individuals, in fact, many individuals, are assigned to Partners to provide care management, and those care managers are employees of Partners. In addition to that, and that's always been the model, by the way, prior to December 1st, the only way you really got care management was through the LME MCO, and in our area, that was Partners. But now there are a couple of other options. One is called a care management agency, or CMA. And a care management agency is really a provider agency that has expertise and experience supporting individuals with mental health, substance use, or intellectual and developmental disability needs that has chosen to also provide care management. They've chosen to go through a certification process with the Department of Health and Human Services to become a certified care management agency. Advanced Medical Home Plus, that is essentially a primary care provider, a primary care physician clinic office that has chosen to become certified to provide care management in addition. So the three options are the plan itself, and in our case, Partners, a care management agency, or an Advanced Medical Home Plus, AMH Plus. So you can contact Partners for a list of those agencies and the areas they serve. Each of the agencies is certified. The CMAs and AMH Pluses are certified for specific populations. So one provider may be certified to support members with intellectual and developmental disabilities, whereas another one is not. Or one agency may support adults with mental health or substance use needs, but not support members with or children with those needs. So they each have certification areas, and they also choose which counties they will support and how many individuals they will support based on their staffing and how many care managers they have. So it's really not as simple as giving you a list and you can choose any of the providers on the list. It really does depend on what your area of disability is and where you live as to which of the agencies are available to you. Next slide, please. As I said before, member choice is a huge factor in the tailored plan. Members can not only choose who their care management provider is, but you can also change your mind. So if you chose a care management agency or you were assigned a care management agency and you have decided that you want a different agency, just contact us and we can make that happen. Anytime between now and April 1st, you can change your care management agency without giving a reason, without there being a cause, and you can do that several times if you want to. So if you start with an agency and it's just not meeting your needs and you want to change, you just need to let us know. You can call us, or you can also make that request through our member portal, which is called Member Connect. And if you go to our website, you will see how to establish a Member Connect account. You can also opt out. And what that means is you can say that you don't want tailored care management. Out of over 50,000 people, I believe we've had about 50 or so at this point opt out. But the other thing is, if you opt out, you can also opt back in. If you say, I don't want tailored care management, but you change your mind later, all you have to do is contact us and you can opt back into tailored care management. Members already assigned to your preferred tailored care management agency don't have to do anything in terms of being ready for the tailored plan launch April 1st. If you have been assigned to a care management agency, for example, you're going to continue to be assigned to that care management agency once the tailored plan launches April 1st. You don't have to declare your choice again. The next slide, please. One important thing to understand that does somewhat limit choice is something called conflict-free care management. And this is a federal rule, a Centers for Medicaid Medicare Services rule that the state of North Carolina has to follow. And it basically says that individuals who receive home and community-based services cannot receive care management from the same agency that delivers the home and community-based services. So in North Carolina, home and community-based services are the North Carolina Innovations Waiver, the TBI waiver. We don't have that in our area, but it is one of the HCBS services, and 1915I benefits. Now, you all are probably not very familiar with what's called 1915I services. Right now, those services are called B3. So if you receive a B3 service or an Innovations Waiver service from one of those agencies that is certified to provide care management, you can't receive care management from that agency and continue to receive those direct services. So that's a little bit confusing because in other situations you can. So if you have a mental health need and you receive outpatient services and med management from one of the care management agencies, you can also receive your care management from that same agency. Many individuals are receiving their tailored care management from the same agency that delivers their services. So this is an exception for individuals who receive Innovations Waiver services or B3 services, that you cannot choose the same agency. And again, it applies to the Innovations Waiver, the TBI waiver, and B3 services, which will later be converted to something called 1915I services. Next slide, please. So the Department of Health and Human Services is partnering with us right now to do what's called tailored care management assignment. And what that essentially means is that for those individuals who did not make a choice during the choice period, the individuals did not call or contact us and indicate who they wanted to be their care management provider, those members were assigned a care management provider. And there's a process that is followed to make those decisions. One of them is looking at existing relationships. So for individuals that did not have that, conflict-free care management was not a problem for, we wanted members to be able to receive their care management from that agency where they already have a relationship. So looking at what relationship, where you get your services, was very important. Members' preference, of course, drives everything. Specialty or complexity of needs. So, for example, individuals who have significant medical concerns might have been assigned to an advanced medical home plus because they have the most medical expertise. Individuals who are in the foster care program or the innovations waiver or the transitions to community living program were assigned to the plan unless the member expressed a preference to be assigned otherwise. The other thing that was considered is location of the agency relative to where you live. So is this agency supporting your county and is close by? And then the capacity, does the provider have the capacity to take more members? As I indicated, each of the care management providers was able to indicate how many individuals they could support. So they could tell us how many children with mental health or substance use needs, how many adults with mental health or substance use needs, how many individuals with intellectual and developmental disabilities, for example, that they could support. And we can only assign additional individuals to that provider if they do have the capacity. The other thing that was considered, of course, is conflict-free care management to make sure that you were not assigned for care management to the same agency delivering the innovations waiver or B3 service. Next slide, please. So in summary, the tailored plan members are eligible for tailored care management. And in addition to that, many Medicaid Direct members are eligible for tailored care management. Members either choose or are assigned the agency to provide their tailored care management. Members can change agencies just by letting us know. Members can opt out of tailored care management, and if they do so, they can choose to opt back in at any time. Tailored care managers assess your needs, develop a plan for the whole person, and are part of a multidisciplinary care team. And then tailored care management is available throughout the entire duration of your enrollment. That's another big difference in what's happening now versus what was happening before. So prior to December, people could get care management, but for many of them, it was just short-term care management. This tailored care management is much more comprehensive, is available to many, many more people, and it's also a continuous availability. So it's not just you can get care management for 6 months or 8 months and then it fades out. For individuals with Medicaid, it's a ongoing support throughout your enrollment in the tailored plan. I believe probably the next slide is questions. Oh, no, it's contact information. So this is important information. So we have established phone numbers. Melissa's going to put this in the chat if you want to cut and paste. We've established phone numbers for our screening and referral teams. There's one for intellectual and developmental disabilities, or TBI, traumatic brain injury. There's a different number for mental health and substance use. Then you can also call our partners member and recipient services line. You can connect with us via the member portal, which is called Partners Member Connect, or our member engagement department. So there's a lot of different ways that you can reach us. If you reach one of those numbers and you have to leave a message on a voicemail, just know that we are making every effort to return those calls within the day, or certainly by the next day. So those calls are being returned very quickly if you do have to leave a message. Again, Melissa was putting those in the chat if you want to copy and paste those. Next slide, please. And now we are at the questions. So I think Beth was going to facilitate the questions.
Yes, I'm going to give my fellow panelists a moment to get ready to come back on camera so we can start our Q&A time. Okay, we have one question. Do people have to have Medicaid? Do people who have Medicaid Direct have to apply for tailored plans?
Well, that's a really good question, and it may be a little bit complicated to explain. So essentially, prior to December 1st, or even now really, you are either enrolled in a standard plan or you are enrolled in Medicaid Direct. So if you're not part of one of the standard plans, you're in Medicaid Direct, and that means you get your services fee for service. So you get your behavioral health services through the LME MCO system, the local management entity managed care organization system, and you get your physical health services, and those are billed basically to Medicaid, directly to Medicaid. Based on certain factors, you would have been identified as someone eligible for the tailored plan. So if you have significant mental health or substance use needs, or a traumatic brain injury, or an intellectual and developmental disability, the Department of Health and Human Services would have already identified you as someone who is going to be eligible for the tailored plan. So you don't have to apply to be enrolled in the tailored plan. You would just be auto-enrolled, automatically enrolled, and you would receive a letter that says that you've been enrolled. If you get a letter that says you are currently in the Medicaid Direct program and you are going to continue to be in the Medicaid Direct program, you do have the option of raising your hand and saying that you don't think that that's right, that you would like to be considered for the tailored plan. To do that, you would need to call the enrollment broker, and hopefully someone has that phone number who can put it in the chat. But most people who are going to be enrolled in the tailored plan, it's going to be an automatic process. You don't have to apply. You will just be automatically enrolled and receive that notification.
And this person said, thank you, that answered the question. So
Good,
someone
thank you.
is having a little bit of difficulty copying and pasting from the chat. We can send these numbers out in an email, a follow-up email, after this is over. And that is all we have currently in our Q&A right now. Anne, would you like to move forward with our next piece of?
Sure, I'd be glad to. I have a little bit more information to share with you about partners. And then certainly if you come up with any more questions, feel free to go ahead and drop them in the chat, and we will have another Q&A time before we close out. All right, so one thing I wanted to share with you is about Member Connect. You heard Tammy mention it, I think twice when she was talking about ways to connect with partners to request about your tailored care management. You can also request about your primary care provider and find additional information. So on our the partners website, either the tailored plan website or our current legacy site, in the upper right-hand corner, you'll see the word Member Connect. You simply click on it and you can log in if you've already created an account. If you don't have an account yet, you can go ahead and create it. So each member can have an account. If you're a family member and you have more than one individual with Medicaid, you would have a separate login for each child or each family member. So next slide, please, Beth. And when you log into Member Connect, this is what you're going to see. So it is just a super simple way to find information. It's going to take you with some links directly to our website, for example, to find the member handbook. You can also, like I mentioned, make a request to change your tailored care manager, your primary care provider, etc. You can also click right in the center there, it says health screenings. You're able to access health screenings. It goes straight to our website, gets you directly to that point. So you don't have to be perusing around to find what you're looking for. So just a great way to stay connected. You can also message us directly to ask a question, to ask to be connected to someone within Partners or maybe part of your healthcare team. So a great way to get information at your fingertips, our member portal, Member Connect. So next slide, Beth. Another thing that's good to know is members can transition between health plans for different reasons. It could be because the member's service needs or needs in general change. It could be because you move to a different county. And so your residence change. So maybe your coverage changes, or maybe something changes with your Medicaid. So we have here at Partners a transitions of care team that's going to help you transition to between plans. You can also reach out to the North Carolina Medicaid enrollment broker about that process. They have a form that you can fill out to make that happen, or your provider or current health plan can help you complete that. It's called a request to move form. So that's transitions of care. So next slide, please. Member engagement. So here in member engagement, we are here to support our members with advocacy, navigation. If you don't know who to talk to at Partners and you have questions, member engagement is the place to be. We're here to listen. We care and we want to help you take action. We also bring the members' voice back into our organization to ensure that we have good processes and are meeting member needs. So if we go to the next slide, you'll see our phone number right there in the center, 704-884-2729. When you call this number, this is a work group within our member engagement team, and you will be able to talk to a specialist that can help answer your questions or get you where you need to be for the best information. All right, so now I want to share with you about the Pix Health mobile app. I hope you've heard of it. And if you haven't, sign up today. So the Pix Health mobile app, it helps you monitor physical and mental health and encourages our members to, we want to encourage our members to register for the Pix Health mobile app. You can download the app by going to www.hipix.com, and the app will enable you to interact and engage with a sweet little chat bot. You can see him there on the right side of the screen. Can help you access resources and give you helpful tips. It really focuses on daily mood and wellness check-ins, provides screenings for depression, anxiety, and loneliness, and offers messages and assistance through the app or through calling the Compassionate Call Center. The call center, you're able to chat with the staff with Pix Health. They're called Andes, and Andy stands for Authentic, Nurturing, Dependable, and Your Friend. And so through the interactions with the app and the Compassionate Call Center, Pix will send referrals back to Partners so that we then can reach out to you as well and keep your care managers in the loop and bring you the support that you need. You'll also find research-based games and activities inside the app. So check it out, Pix Health mobile app. Another thing I want to let you know is who should you call? So if you currently are receiving services, your provider is always your first line of service to answer your questions. They're your first responder in crisis. If you have a care manager, then you're going to want to reach out to your care manager. If you're not in services and have general questions, as I just mentioned, give us a call here at Member Engagement, 704-884-2729. Or if you prefer to communicate via email, you can send us an email at memberquestions@partnersbhm.org. And certainly you can always call our member services line at 888-235-HOPE or 4673. So let's talk a little bit about our Consumer and Family Advisory Committee. You may have heard of it. It's also referred to as CFAC. So CFAC is a volunteer group. It's made up of members representing those who receive mental health, substance use, traumatic brain injury, and IDD services. So our CFAC advocates on behalf of those individuals to improve our behavioral health system. The Partners CFAC is looking for new members. So for more information, you can email us at cfac@partnersbhm.org or call our member engagement line at 704-884-2729. You can also reach out to Cindy Troba. Cindy is our member engagement manager and a member committee liaison. And there's a phone number there for her as well, 828-323-8090. Or you can go to our website and look for information about CFAC. And there's the link at the bottom of the screen. And Melissa is going to drop that into the chat for you as well, if she hasn't already. Then there's one last thing I want to share with you. An important one. Stay in touch with us. Keep your contact information updated. There's a lot of information going out, especially these days with the changes going on with tailored plan, tailored care management, et cetera. So you want to make sure that you keep your address and your phone number up to date. You can do that by reaching out to us on the Member Connect that I mentioned, or giving us a phone call. If you are a Medicaid recipient, you absolutely want to make sure that you update your address with your local Department of Social Services, DSS. They are the keeper of the information that updates our system on a regular basis. So your address and phone number update all the time. So you really want to keep your DSS case manager up to date. And then, of course, if you receive state-funded services, you just want to give us a call in our Partners Access Department Member Services at 888-235-HOPE 4673. All right, so that is all the information we have for you today. Beth, do we have any additional questions?
We do. I'm going to give everyone just a moment to get prepared, and I'm going to take us back to gallery view. Okay, we did have a follow-up question. It's got a couple of questions in one big one. So following up on the question about Medicaid Direct to tailored plan. This person recently moved to North Carolina, and they are waiting on a psych eval to switch from standard plan to Medicaid Direct. And of course, this means that our son will be on the run. Will he automatically be enrolled into the tailored plan? The enrollment broker will help us get switched from standard plan to Medicaid Direct. But does this cover the enrollment into the tailored plan as well?
I could take that one. So it should. So individuals who are on the Registry of Unmet Needs, the Registry of Unmet Needs is the waiting list for the North Carolina Innovations Waiver. Individuals who are on that Registry of Unmet Needs, or who otherwise are identified as having an intellectual or developmental disability, are being enrolled in the tailored plan. So if your loved one is on that list or has a developmental disability, you should be auto-enrolled in the tailored plan. If not, if you do not get a letter saying that you will be auto-enrolled, you would contact the enrollment broker the same way you have to try to go from the standard plan to Medicaid Direct and request the tailored plan, and they can facilitate that. But your loved one should be auto-enrolled if on the Registry of Unmet Needs.
Thank you, Tammy. We do not have any more in, oh. The next question is, will any of these changes directly affect mental health providers and or the billing of mental health services?
They should not. So those mental health providers are already in our provider network, and they are already paid for the services that they are delivering. And that should not change with the implementation of the tailored plan.
The only way that could change is if a provider would opt out of being in the tailored plan, but that would be a very, very rare occasion.
Good questions.
Currently, we have no more questions in the queue.
All right, so this is your last call for any questions. We are actually finishing up early today. That's very unusual. So I'm about ready to give you a few more minutes back in your day, unless we have any additional questions come up.
Not yet.
No. All right. I am going to take that silence as you don't have any more questions at this time. And then, of course, you can always reach out to us if you do. So thank you all for joining us today and spending your time with us here for the Member Cafe. Plan to join us. We will be ready to go back in January. Our topic in January, our guest speaker will be from North Carolina DHHS, deaf, hard of hearing, and they'll be here to share with us about services that they can offer for the deaf and hard of hearing and blind community. So again, thanks for joining us, and we hope to see you in January. Have a wonderful holiday season. Bye, y'all.